So the leadership I can say they had given us was how to work with governments, just how to work for one government and the other government and bring ideas together, and also on how to just bring the people more affected, such as the key population or the other CSOs who are civil society organization to the table and just have one mind and solve this. Also, one of the things that they've helped is the support to the healthcare workers. I think they had shown leadership on how they could be supported to do this work very well. And apart from that, the research, the innovations that we've enjoyed, and it has been very good. HIV itself, from HIV getting AIDS, it affected so many sectors. So investing in it was very much efficient than investing in even 10, 20 diseases at the same time. So it depends with the effect or the repercussions that that disease has. And one thing I can say, like HIV itself, it just needed a concentration or a scale up to an extent that we bring it down or we get it controlled for us to start looking at other things. So this method of concentrating on one disease, HIV, deserved it. And it still deserves this up to now. Just like COVID, we needed to concentrate on it so that we bring it down before we go forward, because it was more or less affecting all the gains we've enjoyed in the health sector. I grew up with a brother when I was young. He was taking care of me. And, in Africa, we take care of each other. So he was taking me to school. I started my grade 8, I was in boarding. Grade 9, I was in boarding. And boom, he passed away. Afterwards, the wife passed away. The children passed away within a short period of time. And all that was because of HIV. So PEPFAR saved lives. PEPFAR helped people that were losing parents not to lose them anymore. So they've done so much for nations that were affected, like the Southern African nations. I think as a person who saw HIV at its peak, I can say thank you. This is an infection where if you're not taking drugs, you can still have a high viral load, making you a person that can transmit it to the other person. So meaning it still needs sustainability, and that sustainability still needs support. So the governments to work together with PEPFAR so that we find a solution on how we are going to sustain these gains that we've gained. It's one program that the US demonstrated leadership. It's one program that makes countries like us, when you hear, where I come from, Zambia, when you hear the US, you want to protect it. Not because of anything, but because of that help, the commitment that they've shown over 20 years. That support is what makes PEPFAR unique. It even makes the US actually unique and stand out as not only going to support a certain program because they want something out, but supporting a program so that lives are protected or lives are saved. The child sees the mother tomorrow. That's very important. This economic thrives tomorrow. Like I said, life expectancy improves. I think that has been tremendous and will forever be grateful to PEPFAR.